What's it like to be 65 and thrive?
Oh, it feels great. My health is very, very good.
Retiree Susan Thomas and her husband Steve Hutchinson recently chose the same doctor to simplify their lives.
We don't think of ourselves as old, but we're realistic enough to know that we're moving in that direction.
We can count.
Yeah, exactly.
Every day, like these two, 10,000 baby boomers reach retirement age. And just like you do routine maintenance on your car, they believe in prevention.
The format encourages you to talk about things when they are
Not an issue, exactly.
not an acute issue.
This is their healthcare home. Just 3 years ago, this building with the big circle at 71st and Center Street opened its doors with a new concept in healthcare. It's called Think Whole Person Healthcare.
Really, it's meeting the patient where they're at. It's understanding the patient's lifestyle. It's understanding what means the most to the patient.
Think's model puts the primary care doctor at the heart of treating patients, with support staff all taking time to talk to the patient.
These are all my caretakers in the greatest sense of the word.
Connie Jonk is here for pain management. It's not unusual to see staff meeting with patients on couches in a living room setting.
They call me on a regular basis and say, how's today going for you?
Her nurses call her. The in-office pharmacist knows her by name. She sees the doctor monthly or quarterly to prevent problems from turning into an ER visit or hospital stay. Patients say it's health care rooted in customer service.
We don't want the patient to have to wait 45 minutes to see the physician. There's no other area of customer service in our lives as Americans that we'd accept that. We shouldn't accept that in medicine.
Think is one of 8 accountable care organizations in Nebraska. They aim to care for patients in a cost-effective way. And for the first time ever, Think's been rewarded for keeping Medicare patients healthy, with millions of dollars in shared savings money from the federal government.
And really what that represents is a shift from volume of care to value of care. So we are rewarded for keeping people well.
It's an investment poured back into the healthcare model.
It goes right along with medicine in keeping people well. It's about people, and they are about people.
And it's about not letting illness spin out of control. So when it comes to government programs like Medicare, everything is measured. Think saved on average about $600 per patient and had 20% fewer hospital stays than the national average. Allegiant Health Partners and Midwest Independent Physicians also received shared savings money.